Hello, my name is Lo Xiaoqin with the matrix number of A165565. I'm from group number 5 and the current issue topic that I'll be talking about today is pandemic COVID-19. In 2020, a significant threat to the public health emerged. The novel SARS acute respiratory syndrome coronavirus 2 epidemic outbreak emerged in December 2019 from Wuhan City, Hubei Province, China, and spread to the rest of the world. This disease was named by COVID-19 by the World Health Organization. To the date of 17 April 2020, a total of number of 2,230,000 cases of COVID with 1,500,000 cases of death and 564,000 cases recovered has been reported worldwide. The transmission of coronavirus occurs primarily between people through direct, indirect, or close contact with infected people through infected secretion such as saliva and respiratory secretion, or through their respiratory droplets which are expelled when an infected person coughs, sneezes, talks, or sings. COVID-19 symptoms are manifest usually as fever, dry cough, or tiredness. Some infected individuals may have mild symptoms such as headache, muscle pain, runny nose, sore throat, or diarrhea. Some COVID-19 patients may suffer from severe pneumonia, organ failure, acute respiratory tract infection, and septic shock, which can lead to death. In this topic, I will be acting as the law enforcement officer for our country. First of all, I believe that prepare and establish of standard of procedure (SOP) will help out the citizen to cut off the transmission of virus in our country. We need the citizen to obey the social distancing from everyone while they are outside, because this is an effective way to prevent the spreadness of virus. Next, taking legal action to the citizen who disobey the procedure will be also important. Anyone who disobey the standard of procedure will cause the increasement of disease, and which may significantly affect the country in terms of economic and healthcare. Furthermore, the number of daily patrolling from the enforcement unit will be enhanced to make sure that none of the band of outlaws fellows have the chance to break the rules in our city, because they might have take the opportunity to do something against the laws, for example burglaring or robbery. Lastly, the setup of travel restriction for the outsider or the citizen of Gulf country is much required, because this is able to cut off the link of spreadness of virus in our country and to prevent the outsiders to bring in the new kind of metamorphic virus. That's all from me. Thank you.
Hello, my name is Lim Tian Sun with the metric number A164485, and I will be presenting about the role of international organizations in the attempts to curb the spread of the COVID-19 pandemic. International organizations such as the World Health Organization and the United Nations have an important role in helping to stop the spread of the virus through assisting in the cooperation of the different countries within their organizations. The most important role of an international organization in combating a pandemic is establishing international guidelines. These help by ensuring various countries adhere to the necessary precautions required to combat the pandemic. Regulations such as travel restrictions and quarantine guidelines are important in helping to stop the spread of the virus. At the start of the pandemic, the WHO performed their duties by recommending appropriate responses for the various countries hit by the pandemic. Our current social distancing and 14-day quarantine rules are all as recommended by the WHO. Secondly, international organizations facilitate information sharing between its member nations. Information is essential in a pandemic, especially one with an unknown virus as the cause. Statistics of transmission vectors, transmissibility, the onset of symptoms, and the deadliness of the virus are all key information that can help countries combat the disease. These data are important in ensuring all countries carry out the appropriate response for the pandemic, and it is up to the existing international organizations to help share the information available between its member nations. Also, international organizations are essential in the development and later distribution of the treatment or vaccine. Development of vaccine for a new disease is difficult and requires the coordinated effort of experts from all across the world. In addition to that, once the vaccine is successfully developed, international organizations are responsible for distribution and production. This helps ensure that people and nations across the globe have access to this life-saving treatment and that the treatment is distributed properly and efficiently. Therefore, it is shown that international organizations have an important role to play in the fight against the pandemic. It is imperative that all of us do our part in this period of crisis as the pandemic affects all of us.
Hi, my name is So Jun Singh and my writing number is A165620. A total of 3,631 new COVID-19 cases were also recorded, with the Klang Valley area comprising Selangor and Kuala Lumpur accounting for about half of the new infection. There are also 40 more fatalities due to the coronavirus. Malaysia's Senior Minister Ismail Sabri Yaakob said on 19th of January that all states of Malaysia, with the exception of Sarawak, will be placed under MCO from this Friday. This will be effective on 22nd of January and last until 4th of February. That means that residents are not allowed out, except for two from one household for daily necessities, including emergency cases. Therefore, does the MCO mean that I have to temporarily shut down my business? No, the MCO only requires non-essential businesses to close their business or office premises. However, this does not mean that the business has to shut down or stop running, especially if the business can continue running or be operated remotely on a work from home basis. Therefore, how can the business survive during this COVID-19 crisis? Here are some areas of focus and how we are able to benefit from it. Firstly, prioritize your staff. Constantly check their physical and mental health. Provide them with the necessary tools for them to maintain the productivity when working from home. Secondly, implement alternative arrangement with your customers, suppliers, and relevant parties to minimize the disruption. This ensures that your business can continue to operate. Lastly, protect your key business functions. Evaluate your business processes to identify which are the most vulnerable or profitable. This will help you protect your most valuable assets and also minimize your losses. That's all for me. Thank you.
Hi, my name is Pierre Chow Fang Cheng with the student number of A165847 and I'm from Group 5, discussing on the topic of pandemic coronavirus COVID-19 because we are all currently in the midst of COVID-19, thus making it a very hot topic nowadays. And I'm presenting the role as a Department of Health. As for my thought, Department of Health is an essential department for a country. When there is this pandemic or whatsoever disease occur, it acts as a heart in the combat against the pandemic. During this critical period, when the pandemic starts to spread in the country, Department of Health would take in control and ensure that medical equipments are sufficient in the hospital all over the country and a backup for them, like the swab test kit and ventilator. Other medical essentials like personal protective equipment, PPE, gloves, and masks are the most important ones, as they are widely used not only by those healthcare workers, but also the public, and they are disposable. Apart from that, promoting news transparency to the public is also necessary. For instance, when they keep count of those positive cases and the number of cured patients daily, they shall announce it to the public together with the symptoms and where have the victims been to before they got admitted in ward. This is to soothe the emotions of the public and preventing chaos from happening. People are scared and anxious about this pandemic, especially when there is no cure for it this far, which makes them feel insecure, and thus how Department of Health acts in handling this problem is critical. Which is why it is a good practice when our country promotes this news transparency to the public took an action, and together with the cooperation with the other roles, we shall be able to win this combat. Thank you.
Hi, my name is Ko Yu King and my matrix number is A164897. My group topic is about COVID-19 issue. COVID-19 is a pandemic that hit the world in 2019 and started in Wuhan, China. In this issue, I am playing as a medical researcher role, and now I am going to talk about my role as a medical researcher to stop the spread of COVID-19 disease. Firstly, as a medical researcher, my aim is to produce an effective vaccine to cure the COVID-19 disease in the shortest period of time. This is because I want to lower down the number of COVID-19 cases and as well as the number of deaths. Secondly, COVID-19 is a new virus that found in 2019. So this is a new virus that we never encountered before. Before that, we need to study the physiological process and health of human to understand how the human body responds when presented with COVID-19 disease. Next, we as a medical researcher, we also must conduct trials and research in the lab for many times so that we can produce a safe and good quality vaccine. A several testing should be done on the vaccine to check for the effectiveness before the vaccine can be reached to the public. Other than that, we as a medical researcher, we must follow a strict and safety guidelines when producing the vaccine. The vaccine produced must get approval from the WHO organization and also the Ministry of Health in the government so that the vaccine is safe to use and can be distributed to the citizen. As a conclusion, medical researcher is a very important role in order to stop the spread of COVID-19 disease. Vaccine is very important to save everyone's life, and I hope that with vaccine we can get back to our normal life. Thank you and stay safe.
Hi, I'm Lee Chong Pang, A165X45 from Group 5, and for my talks, I would like to present about the COVID-19 pandemic toward the general public. So, there are some aspects that I would like to share about the effects of COVID-19. First one is the effect to our daily life. As we all know, the COVID-19 pandemic has affected every general public's day-to-day life. People were prohibited from attending mass gatherings such as religious, sport, social, and cultural events. All the places of worship and some non-essential business were closed temporarily, and all the steps of precaution such as wearing masks, social distancing are needed to be followed when we are going for dining, buying stuff, and all that. And the second one will be the workplace. During this pandemic, there are many people lost their job or even closed their business. For those who still keep their job, some of them are being assigned to work from home, and for those who are still going for work, there are a lot of SOP that need to be followed, otherwise it will cause the spreading of the virus in the workplace. The last aspect that I would like to talk about will be the entertainment and traveling activities. As we can see, all the cinemas, karaoke, and all the entertainment stations are closed during this pandemic. And for now, all the foreign tourists and visitors are forbidden entry to Malaysia. At the same time, we are also not allowed traveling to other countries as well. Although the government in Malaysia has set all the steps of precaution during traveling in our country, we still can see there are many people that are not following the rules. So for me, I would think that now is not a suitable time for every public to go for traveling. So all in all, this COVID-19 pandemic outbreak continues to have a strong impact for everyone. Besides from providing effective vaccine, the most important things to stop this virus is the awareness of general public. So that's all for me. Thank you.
Hi everyone, I'm Chan Jiaojun and my student number is A16558. I'm from Group 5 and my group has chosen the topic on the current pandemic issue, which is COVID-19. In this project, I'm playing a role as a healthcare worker. The global healthcare system has lacked in its ability to effectively respond to novel and highly contagious viruses. However, They are learning and updating protocols for diagnosing, treating, containing, and curing these types of global pandemics. Due to the crisis of COVID-19, frontline healthcare workers are now expanding their roles dramatically and assuming greater responsibilities to fight against this viral epidemic. Nurses become the most important player in the screening, early diagnosis, and ongoing monitoring of infected patients. Nurses also assume the vital role of documenting a patient's status and communicating it to the other health officials. To reduce the traffic in and out of the rooms, nurses may be required to assume duties of other personnel, such as technologists and housekeeping. In this pandemic crisis, medical assistants may be needed to provide greater assistance and increase their clinical responsibilities as doctors and nurses become overloaded. As the number of patients surge, medical assistants may need to perform more of the first stage procedures, including patient education and triage. Medical assistants may also be utilized for care services such as remote psychological monitoring under the supervision of the physician or other qualified healthcare professionals. Lastly, for medical office administrators, perhaps the most valuable role is communication during this pandemic. In addition to cancelling and postponing non-critical appointments and procedures, medical office administrators are relied upon to communicate the status of patients who have tested positive to the appropriate officials. Once they have done so, steps can be taken to track and contain the virus. Medical office administrators can also help to secure adequate medical supplies, personal protective equipment in particular during an outbreak. These supplies may include masks, gloves, eye protection, sanitizers, isolation gowns, testing kits, medications, and other life-saving equipment. To sum up, healthcare workers are valiantly working long hours despite of the grim statistics and uncertainties. In fact, thousands of healthcare workers have been battling COVID-19 with tremendous courage, ingenuity, and determination. At this point, they deserve our utmost gratitude and support, and no one can predict the number of casualties that will result from COVID-19. We shall all work together and combat this global threat. Thank you.